Welcome to today's webinar titled Making the Most of Your TRICARE Pharmacy Benefits. We are thrilled to have with us today Lieutenant Commander Tisha Robertson, a U.S. Public Health Service pharmacist with the Pharmacy Operations Division at the Defense Health Agency. Without further delay, I will turn things over to Lieutenant Commander Robertson.
Thank you, Paul. And welcome again, everyone, to the TRICARE webinar entitled Making the Most of Your TRICARE Pharmacy Benefits. Again, my name is Lieutenant Commander Tisha Robertson, and I'm a pharmacist within the Purchase Care branch of the Pharmacy Operation Division within the Defense Health Agency. I'm joined today by a number of my colleagues from the Defense Health Agency, as well as Express Scripts, our Pharmacy Benefit Manager. We look forward to answering your questions during the question and answer section. However, before we begin, I'd like to read the disclaimer. Slide 2, please. The appearance of hyperlinks does not constitute endorsement by the Department of Defense of this website or the information, products, or services contained therein. For other than authorized activities such as military exchanges in morale, welfare, and recreation sites, the Department of Defense does not exercise any editorial control over the information you may find at these locations. Such links are provided consistent with the stated purpose of this Department of Defense sponsored webinar. Slide 3. For our presentation today, and as noted in the agenda, we will begin with the TRICARE Pharmacy Benefit Overview. Then we'll discuss some drug categories and take a deep dive into the TRICARE Formulary Search Tool. We will also touch on available pharmacy options along with pharmacy costs, and we'll end our discussion on one of the hottest topics today, COVID-19. Slide 4, please. The TRICARE Pharmacy Program provides prescription drug coverage to all 9.4 million TRICARE beneficiaries. Under the TRICARE Pharmacy Benefit, prescriptions can be filled through a military treatment facility pharmacy, home delivery pharmacy managed by Express Scripts, who also manages the pharmacy benefit for TRICARE, or your prescriptions can also be filled at a retail network pharmacy. Please note that if you use the U.S. Family Health Plan or you have separate pharmacy coverage, we will not be covering that under the scope of this presentation today. To learn more, you can go to the link tricare.mil/pharmacy. Slide 5. There are 4 categories of drug coverage. These categories are based on the medical and cost effectiveness of the drug compared to other drugs of the same type. For further information, I wanted to share what the categories include. Generic formulary drugs are usually the lowest out-of-pocket cost drugs and are usually widely available. Brand formulary drugs have moderate out-of-pocket costs and are generally available. Non-formulary drugs have higher out-of-pocket costs and may have limited availability. And non-covered drugs are the highest out-of-pocket costs, as you pay 100% of the drug's cost, and these drugs are not covered under the TRICARE Pharmacy Benefit. On a quarterly basis, the TRICARE formulary is reviewed by the Pharmacy and Therapeutics Committee, otherwise known as P&T Committee. Following the review, some drugs may move from one category to another, depending on the cost effectiveness and the medical data available compared to the other drugs. If your prescription drug changes categories, our Pharmacy Benefit Manager Express Scripts will send a letter notating this category change. Slide 6, please. The TRICARE formulary is a list of covered generic and brand name prescription drugs. TRICARE covers most prescription drugs approved by the Food and Drug Administration, or FDA. To learn more about coverage of your prescription medication and co-payments, you can refer to express-scripts.com/tform. In the next few slides, we will walk through what the TRICARE Formulary Search Tool looks like and how you can navigate the tool to search for a drug. Please note that we are expecting an update to the search tool, and it may look different to what's being presented today in the near future. Slide 7, please. Upon entering into the TRICARE Formulary Search Tool, you'll need the name and the strength of the prescribed drug to complete the search. Once you select your gender and age, you can input the drug name and click Search. Slide 8. Then, the next screen is a pop-up screen where you're able to select the prescribed drug and strength. Slide 9, please. Once the prescribed drug and strength is selected, The online formulary search tool will tell you the drug formulary or coverage status. It also includes the pharmacy options along with the cost shares up to 90 days for home delivery and 30 days for retail. In addition, if your prescribed medication needs a coverage review from Express Scripts, the prior authorization and medical necessity form will also be included. Some medications also have coverage notes. The coverage notes provides information on day supply and quantity limits as applicable for the drug. Slide 10, please. This slide outlines the coverage notes. Of the example we're using is Victoza. As previously stated, the coverage note does show if the medication has a quantity or day supply limit. As you can see in this example, this drug has a limit of 3 at retail and 9 at mail. Slide 11. Prior authorization is required for some drugs to ensure they are safe, effective, medically necessary, and cost-effective. As previously mentioned in the search tool, if a drug requires prior authorization, the prior authorization form, as shown in this slide, is included in the search tool for the specific drug. Not every drug has a prior authorization, and therefore you will not see the prior authorization function for every drug. Your provider may need to fill out a prior authorization if your drug is only used for certain health conditions, has the potential to be misused or abused, or has an age or quantity limit. Slide 12, medical necessity allows you to get a TRICARE non-formulary drug at the formulary copayment. As shown in this example, the Victoza is non-formulary at a copayment of $60. If you are unable to take a formulary alternative and meet certain criteria, and you are taking a non-formulary drug, you may be approved for medical necessity to pay the formulary copayment. Your provider has to complete a medical necessity form to document the non-formulary drug meets certain criteria. Slide 13. Now I'd like to discuss the different points of services, military pharmacies, followed by TRICARE pharmacy home delivery, and then retail pharmacies. On slide 13, military treatment facility pharmacies are usually located at military hospitals and clinics, but some military bases have freestanding pharmacies located elsewhere on the base. For most routine maintenance prescriptions drugs, you may be able to get up to a 90-day supply of your medication. Using the military pharmacies is your least expensive option with no out-of-pocket cost. Prescriptions for formulary medication from both military and civilian providers are usually accepted. You can go to tricare.mil/military pharmacy to learn more or get information on how to contact the military pharmacies of your choice at tricare.mil/MTS. Slide 13. The least expensive option after the military pharmacy is TRICARE pharmacy home delivery. At home delivery, you can get up to a 90-day supply for most prescription drugs. Home delivery is recommended for prescriptions you take regularly, as the drugs can be mailed directly to the address of your choice using free shipping. Please note, co-payments apply for non-active duty service members for all generic formulary brand name formulary, and non-formulary drugs. Certain maintenance medications found at the link provided require that non-active duty service members use home delivery. To use home delivery overseas, it does require that you have an APO or FPO address to be assigned to a U.S. embassy or consulate. To get more information on switching your medication to home delivery, you can refer to militaryrx.express-scripts.com/home/delivery or contact Express Scripts directly at 1-877-363-1303. Slide 15. Many prescriptions can be automatically refilled and delivered to you under Express Scripts Automatic Refill Program. The program requires Express Scripts to contact you when you've reached your last refill of your prescription medication to confirm you would like to continue with automatically having your medication delivered to you, also known as automatic refill. A reply must be received before Express Scripts can take future action or renewing your medication. Slide 16. Of the over 56,000 TRICARE retail network pharmacies, you can get up to 30-day supply of drugs with co-payments for 30-day supply. You can either hand deliver your prescription to the network pharmacy of your choice, or you can ask your provider to send your prescription in electronically. To find a network pharmacy that is close to you, you can refer to the militaryrx.express.com/find-pharmacy. Also, there's a list of covered vaccines you may receive at a participating retail network pharmacy at no out-of-pocket cost. And this list provides the various vaccines that are available, and the list shares all the vaccines that will be available at no cost for you. Slide 17, please. Non-network pharmacies will require you to pay the full price of your prescription drug up to a 30-day supply and file a claim for reimbursement with Express Scripts. Please note that the reimbursement is subject to any deductible or out-of-pocket network costs, shares, and co-payments as applicable. In addition, if you have other health insurance, your other plan pays first and TRICARE pays second. This should be the last resort or option to use if you are in the United States or one of the United States territories. Overseas pharmacies are all considered non-network pharmacies, and costs will be reimbursed by the TRICARE contractor in those instances. Slide 18. If you have other health insurance, otherwise known as OHI, with pharmacy benefits, your other health insurance is the first payer and TRICARE pays second. To avoid higher costs, it is recommended to fill your prescription at a network pharmacy that is also in your other plan's network. Make sure to inform the pharmacist that you also have TRICARE, and your pharmacist will submit your prescription online to both your other plan as well as TRICARE at the same time. TRICARE will be the first payer when your prescription drug is not covered under your other health plan, but is covered by TRICARE, or if coverage is exhausted for the year under your other health plan. With other health insurance, you are unable to use home delivery unless your other plan does not include pharmacy benefits, the drug you need is not covered by your other plan, or you've met the other plan's benefit cap, or if Express Scripts is also the PBM for the other health plan as well. Slide 19, please. The next three slides outlines the pharmacy cost share from January 1st, 2020 to December 31st, 2021. Please note the National Defense Authorization Act, or the NDAA, for fiscal year 2018 directed TRICARE to increase retail co-payments beginning February 1st, 2018. The co-payment increase affected all TRICARE beneficiaries except active duty service members or dependent survivors of active duty service members and medically retired service members and their dependents, whose co-payment remained the same as 2017 rates. There is still no co-payment for medications filled at military pharmacies. On slide 19, it outlines the cost share at generic formulary drugs, brand name formulary drugs, as well as non-formulary drugs and non-covered drugs at military pharmacy up to 90-day supply, home delivery for up to a 90-day supply, and retail pharmacy for up to a 30-day supply. As referenced, the military pharmacy is the least expensive option for our beneficiaries and service members at no out-of-pocket cost for generic and brand name formulary drugs. Generally, non-formulary drugs are not available at the military pharmacy, and likewise for non-covered drugs. At home delivery, the second least option for our beneficiaries, with $10 cost share for generic, $29 for brand name formulary drugs, and then $60 for non-formulary drugs, and it's not available for non-covered drugs. These costs are for 90-day supply at home delivery. Lastly, at retail network pharmacy, the cost share for a 30-day supply is $13 for generic, $33 for brand, and $60 for non-formulary drugs, and it's the full cost for non-covered drugs. As we discussed earlier, there are certain drugs that you must fill through home delivery. Also, there's no cost share for active duty service members. Slide 20, please. At no-network pharmacies for generic formulary, brand formulary drugs, and non-formulary drugs under TRICARE Prime, the 50% cost share applies after the point of service deductible is met. Those not enrolled in TRICARE Prime, the cost share is $33 or 20% of total cost, whichever is more, after annual deductible for formulary drugs, and $60 or 20% of total cost, whichever is more, after annual deductible is met for non-formulary drugs. Non-covered drugs are drugs. Slide 21, please. The last pharmacy cost share slide outlines overseas pharmacy active duty service members and their family members in TRICARE Overseas Program, or TOP, may have to pay the full cost upfront and file a claim for reimbursement. There's a zero cost share. Active duty family members using TOP Select and TRICARE Reserve Select members, there is a 20% cost share after yearly deductible. Retirees, their families, retired reserve members, and all others enrolled in TOP Select have a 25% cost share after yearly deductible is met. Slide 22, please. In emergencies, such as natural disasters, TRICARE may authorize early refills where you're able to refill a prescription before your current supply is exhausted, or a new supply because your medication was lost or damaged to an emergency. The applicable co-payments and cost shares for emergency refills. For more up-to-date information, you can refer to tricare.mil/disaster or to the in disaster alerts. You can do so at tricare.mil/subscription. Please. We now want to turn the last few slides into discussing some updates, pharmacy updates as it relates to COVID-19. During the COVID-19, you can continue to get prescriptions filled at military pharmacies as long as the military pharmacy is still open. The facility pharmacy has discretion to utilize resources, including manpower, in an optimal manner to service beneficiaries while balancing appropriate social distancing practices to prevent the spread of disease to medical staff of the beneficiaries. Due to various sizes, beneficiary population, and operational services at military treatment facilities, there is no one-size-fits-all solution that can be directed by a Defense Health Agency. So patients may experience different services if they go from one military treatment facility pharmacy to another pharmacy. Any specific military facility operational questions with the MDF patient care advocate. Military treatment facility commanders continue to evaluate national and regional conditions impacting risks to beneficiaries and staff in determining the operational tempo for phasing operations back towards pre-COVID requirements. Many military pharmacies are now curbside pick, for instance. To confirm that the military pharmacy near you is open, refer to tricare.mil/MTF and contact the pharmacy. It is recommended if the military pharmacy closes to use home delivery, which offers up to 90-day supply of most drugs for the applicable copayment, and you can also use retail network pharmacies to get up to 3 30-day refills for 3 copayments. Slide 24, please. To ensure you continue to receive your medication during the COVID-19 instance, you should call the military pharmacy to see if they can transfer prescriptions to home delivery. Visit the Express Scripts website provided or contact them at 1-877-363-1303 to have your medication switched to home delivery. Please note the transfer to home delivery will require a new prescription from your doctor, which Express Scripts can assist you in obtaining. You can also contact your retail network pharmacy and ask them to call your military pharmacy to transfer your medication or call your provider for a new prescription. Contact your doctor to send a new prescription to home delivery or your retail network pharmacy if you do not have any refills left. Slide 25, please. To ensure there is enough supply for all that need them, a temporary quantity limit was put in place effective April 10 for one inhaler per prescription for albuterol, also known under the brand name ProAir, Preventil, and Ventolin, and levobuterol, also known as the brand name Sonex. Co-payments will be applied to each one inhaler filled through home delivery and at retail network pharmacies for non-active duty service members. To confirm the cost of your medication, refer to the Formulary search tool. As we continue to analyze and evaluate the marketplace supply based on availability of the product to ensure everyone will be able to obtain access to the medication. Slide 26. This slide provides important pharmacy contact information for additional guidance and assistance as it relates to the TRICARE Pharmacy Program, Express Scripts, and the Formulary search tool. And it also provides key pharmacy overseas numbers for your reference. Slide 27. Along with the TRICARE Pharmacy Program Handbook, the TRICARE Pharmacy Program Overview, and the TRICARE Costs and Fact Sheet at the tricare.mil/publications link. This will provide you with additional information and go into more detail into some of what was presented today. This concludes my portion of the presentation. Terry, do you have any questions?
Thank you, Lieutenant Commander Robertson. We sure do. Let's get to those right now. I'm new to the military as a retired wife. At this moment, I have primary coverage with Humana Healthcare. I paid for it through work. How can I cover the cost of my medicines if my primary cover is already at full coverage? The max amount to cover is $4K and it's already full.
Thank you, Terry. If you have other health insurance with pharmacy benefits, your other health insurance is the first payer, and TRICARE pays second. It's usually easier if you contact your other health insurance to find pharmacies near you and then choose a pharmacy that's also in the TRICARE network. If you use a TRICARE non-network pharmacy, you might pay full price for your medication. At the network retail pharmacy, inform the pharmacist you also have TRICARE, and the pharmacist will submit your prescription electronically to both plans at the same time. For additional information on other health insurance, refer to tricare.mil/plans/OHI/pharmacy/OHI. Else, the other option is to submit a paper claim within 1 year from the original fill date of the prescription, along with the prescription receipt, explanation of benefit, or EOB from your primary insurance, and TRICARE claim form DD2642. Next question, please.
Sure, thank you. Due to manufacturing contamination in China, valsartan hasn't been available through TRICARE's mail order Express Scripts in 6 months. We are having to pay 4 times as much at Walmart. How can Walmart obtain this medication and the military healthcare system cannot? When will it be available again? We greatly appreciate you waiving mail order prescription copays during this virus, but it is no help if the medication a person needs is not available.
Thank you. Pharmacies in the retail network are not required to follow Trade Act agreement laws that the TRICARE mail order pharmacy is required to follow. This allows retail network pharmacies a greater selection of medications available on the market. Next question, Terry.
Sure. Why doesn't TRICARE cover having meds repackaged for those that are living in assisted living housing and on a budget?
Medication repackaging is not a defined part of the TRICARE. Pharmacies in the network may offer this service on their own accord, but availability of the service is not consistent throughout the pharmacy industry. Currently, the TRICARE Retail Pharmacy Network does have 2 pill pack pharmacies in the network, one in Arizona and the others in New Hampshire, that beneficiaries that offer this service for our beneficiaries.
Okay. I am a Navy retiree and have a spouse. Our prescriptions are being sent to a nearby Walgreens from our PCPs, which normally incurs copays. I only have occasional prescriptions for individual ailments, but my wife has prescriptions that are filled regularly, so she also uses Express Scripts. My wife is concerned about utilizing TRICARE pharmacy benefits from our local base, Joint Expeditionary Base Little Creek, because of the long waits in line to get a prescription filled and other potential red tape at the pharmacy. Other than avoiding copays, can you help me understand how TRICARE pharmacy benefits are more efficient and convenient for retirees and their families than utilizing local Walgreens? To start with, can a civilian practitioner send prescriptions directly to a military pharmacy, or must they be hand carried in by the patient?
To answer the first question, using a military treatment facility pharmacy such as Joint JB Little Creek is the lowest cost point of service for our beneficiaries, since, as you pointed out, there are no copays. Unfortunately, this usually results in much higher volume for that pharmacy compared to other retail pharmacies in the area. We would encourage talking with the MTF pharmacy staff on what options you have to limit time needed to spend at the pharmacy. A majority of MTF pharmacies do have electronic prescribing capabilities for civilian prescribers to send non-controlled substance prescriptions directly to the military treatment facility pharmacy. Controlled substance prescriptions, however, must be hand carried to the pharmacy due to the Drug Enforcement Agency, or DEA, controlled substance electronic prescription requirements.
Okay. I have prescription drug coverage from Federal Blue Cross Blue Shield and TRICARE. Can I use the TRICARE mail-in prescription program directly, or does every new and refill prescription have to go through Blue Cross Blue Shield first?
I need to defer this one to Express Scripts. Ms. Katrina Soto?
Thank you. My name is Katrina. I am an account manager with Express Scripts. For this question, when you do have primary insurance with another carrier, you would need to go through that coverage first. So we would not be able to use mail order through the TRICARE pharmacy benefit unless the primary insurer does use Express Scripts as well. When the primary uses Express Scripts, then we can now coordinate the benefits from your primary insurance and TRICARE insurance through the mail order. However, if they are not with Express Scripts, you would not be able to utilize the TRICARE pharmacy home delivery program.
Great, thank you. I'm a dependent of a deceased veteran. Am I still eligible for TRICARE pharmacy benefits?
To be eligible for the TRICARE pharmacy benefit, your deceased sponsor would have to either be medically retired or retired with at least 20 years of active service. Not all veterans meet this criteria. You can reach out to the DARE support office at 1-800-538-9552 for additional information. Next question, please.
Okay. What kind of time frame is involved for notification when submitting prior authorization and/or medical necessity forms?
In terms of prior authorization, there are three options for requesting a prior authorization under which the pharmacy benefit contractor conducts all the reviews on behalf of TRICARE. The first option is the paper form that prescribers can download, complete, and fax to Express Scripts for review. Upon receipt, the review takes about 48 hours for determination of approval or denial to take place. The second option is prescribers may contact Express Scripts by phone and perform a real-time review over the phone to obtain a decision immediately over the phone. The last option, electronic prescribing or electronic prior authorization A, which is utilizes an electronic PA portal, is an online form using this tool similar to the phone option, and it provides approvals in real time as well.
Okay. If the service member has a pharmacy benefit with a private insurance, but it is more expensive than the TRICARE pharmacy, can they opt to use the TRICARE pharmacy?
So this is Commander Parsons. If you have other OHI that has a pharmacy benefit, TRICARE will be secondary to that benefit, and you'll have to use that OHI as the primary.
Very good, thank you. I am retired enrolled in TRICARE Select with OHI. My OHI pays 80% of the drug cost. Will TRICARE pay the other 20%?
In terms of other health insurance and pharmacy benefit, TRICARE does become the second payer. So that will all be dependent on coverage of the drug as well as what's left. And that's a cost share that's determined on what percentage TRICARE would pay. As we mentioned in the presentation, it's best that when you're using other health insurance to use a retail network pharmacy that is in both your other health insurance as well as in the TRICARE network. And that way the pharmacy can run the claim electronically. Otherwise, a paper claim will have to be submitted for determination on coverage of what TRICARE will cover.
Okay. How come I can get aspirin and iron from my MTF, but Express Scripts says it's not covered as a benefit?
As part of the coverage for military treatment facility pharmacy, that's considered an over-the-counter covered medication. However, under the retail as well as home delivery, some over-the-counter medications are not covered and are not considered under the benefit of the formulary. And coverage for over-the-counter medications at military treatment facility pharmacies are subject to change with reviews, and that could possibly change in the future as well.
Okay. What happens if we don't get our controlled meds delivered by home delivery in time, i.e. we need our dose or we will go through withdrawals? What options do we have then to avoid that situation if the meds haven't arrived in time?
I'd like to defer this one to Express Scripts.
Thank you. Yes, this is Katrina again with Express Scripts. If you are waiting for a mail order prescription that has not yet arrived and you are out of the medication, we definitely recommend that you do contact our customer service that is available 24 hours a day so that we can assist in ensuring that you are able to get a temporary short-term local supply at a local retail pharmacy. Of course, this would need to be in discussion with your prescriber, as a temporary short-term supply prescription would be needed to fill the prescription.
Thank you. Next question. Why is the home delivery option not mostly available to beneficiaries with other health insurance or OHI? While I realize this probably reduces the cost of the contract, less need for insurance billing activity, it inconveniences and penalizes those folks who are actually saving the government money by having OHI, especially for those who live in rural, remote areas away from bases or participating pharmacies.
That's a great question. I don't know if anyone else can take on why it's not covered with OHI. Otherwise, we'd have to take that one back and do some additional research.
So this is Commander Parsons again. Tisha, I recommend taking that back, but for clarity, if your OHI is also Express Scripts, you can use the mail order pharmacy. The issue comes down to coordination of benefits. So your OHI is your primary insurance. Oftentimes they have their own mail order pharmacy they want you to go through. And I think that is the main reason, but again, we'll have to take that back. But I believe it's the coordination of benefits that comes into play.
Very good, thank you. Next question. Are compounded medications covered, such as bioidentical hormones, and will TRICARE pay for them?
I think we have to take that one back to gather more information on exactly what is included in the ingredients that is being referenced on coverage for compounds. I'd like to take that one back to get additional information and follow up.
Very good, thank you. If the OHI is Medicaid, does TRICARE still pay last?
This is Francine, and I work in DHA, the Defense Health Agency Communications Division, and by law, TRICARE is primary to Medicaid.
Thank you. If we feel our meds are getting too hot during delivery by mail delivery, what can we do?
I'd like to refer that to Express Scripts, please.
Thank you again. This is Katrina with Express Scripts. So anytime there is a concern with the temperature of the medications through Express Scripts, we definitely would have our beneficiary discuss with our pharmacist, and they would determine the conditions of the delivery as well as the location of the delivery for those packages. There are certain medications that may and do require ice to ensure the temperature stays where it is required. However, if it is determined that it may not reach that temperature that is needed for the medications, then other options would be provided so that you may be able to obtain the medication at retail pharmacy without penalties.
Great, thank you. I'm retiring from my current employer and will be losing my OHI. What's the best way to convert my current maintenance prescriptions to the TRICARE pharmacy home delivery? TRICARE will be my only and primary coverage.
I think are you able to take this one to provide the different options of how they can transfer to home delivery?
Sure. Once the other health insurance has ended, then we would be able to ensure that the TRICARE coverage is updated accordingly, and we can assist in transferring prescriptions through home delivery with different avenues, so that you do have the website that is available for you to log in and transfer prescriptions through mail order or process refills or renewals. We also have our customer service that's available 24 hours a day to assist in transferring prescriptions to our mail order, as well as you can advise your prescriber when filling the medications that they can choose the Express Scripts home delivery to submit the prescription electronically, so they can continue to fill the medications through TRICARE home delivery.
Can you talk a little bit about the changes in the pharma benefits you talked about, transition to TRICARE for Life?
This is Francine from DHA Communications again, and basically, even as a TRICARE for Life beneficiary, the type of plan that you're in doesn't really affect most of your pharmacy benefits. There are, for instance, a few exceptions, like TRICARE will not cover smoking cessation medications for Medicare eligible beneficiaries. It's the way the law was written. But it doesn't matter whether you're Prime, Select, TRICARE for Life. Usually your pharmacy benefit is based on the type of medication, where you're getting the medication from.
Great, thank you. Can you please explain how a Medicare Part D plan with the TRICARE RX benefit?
Okay, this is Francine again. Basically, the Medicare Part D is a prescription requirement established by Medicare. And Medicare has agreed that the TRICARE pharmacy benefit is equivalent to Medicare Part D coverage requirements. So if you do have the pharmacy benefit, you are not required to have a Medicare Part D plan.
Okay. I am a military retiree, and I currently use Express Scripts for all my pharmacy needs. When I switch to TRICARE for Life at age 65, will I still be entitled to use Express Scripts for my pharmacy needs?
Yes, sir. The MTF and Express Scripts, the civilian contract administrator for the pharmacy benefit, will still remain your sources of the pharmacy benefits.
Okay. What is a non-formulary drug?
Thank you. A non-formulary drug is a drug that is considered to be usually a brand name medication that is not a preferred drug, that has been reviewed by the Pharmacy and Therapeutics Committee and have been deemed to consider this as a coverage status. It's usually not as available, and it costs a little more than the formulary brand drugs. So these drugs, as I mentioned, the copayment for the non-formulary drugs at the whole payment is not available at military treatment facility. It's usually $60 at home delivery for a 90-day supply, and at a retail network pharmacy, it's $60 for a 30-day supply. So these are just medications that are not preferred on the TRICARE formulary.
Okay. Military retirees overseas, how can I receive my pharmacy requirements?
This is Francine from DHA Communications. Basically, if you live in a U.S. territory, you still are able to get your pharmacy needs met. And if I am speaking incorrectly, I hope ESI corrects me. But you would still be able to get pharmacy services through a military installation and or through Express Scripts. If you live in other overseas locations, typically for your pharmacy benefit, you will have to pay out of pocket for your prescriptions and then file a claim with the overseas contractor. That's how the prescriptions work overseas.
Okay. Can I get prescriptions at a military hospital or clinic if I'm a beneficiary but don't get my care at that facility?
Yes, if you have access to a military treatment facility, I apologize if I overspoke somebody. You can get your prescriptions filled there. Many times, if you have your civilian provider, they can e-prescribe and might be able to send it to the MTF directly if there is an MTF in your local area. Otherwise, you may want to find out whether or not and confirm whether or not that military treatment facility carries the medications that you need.
Okay. Our local pharmacy closed, An EpiPen I had was recalled. The rule is I have to return to pharmacy, but it is closed. How do I get the EpiPen replaced?
That's actually a great question, and I'd have to take that back to see what options there are in getting the EpiPen replaced. But I would assume that you would try to go to a different pharmacy if the pharmacy is closed, so that you're not without the medication, since that is one of the urgent medications that you would need. But that one I'd have to take back to just get the correct information and guidance.
Okay, thank you.
Hold on a second. Was the statement that the EpiPen was recalled?
Yes, that's what he just mentioned, Commander Parsons. I was going to mention the Mylan.
Okay. You want to tell them about that, Melissa, that it's not recalled?
Yeah, sure. So this is Melissa with Express Scripts. We sent out a letter saying that it was recalled because that was the original communication we received. The FDA further clarified, saying that the EpiPen was not recalled. It was just a safety update. But that being said, if you do have an EpiPen, you can contact Mylan customer relations to find out if it's a particular one that you have problems with, and they could provide you a replacement at no additional cost. If you're waiting, the phone number for Mylan customer relations is 800-796-9526. That's, again, is 800-796-9526.
Great, thank you. And not specific to EpiPen, this is somewhat related. My military pharmacy is closed. How can I get my prescription sent to a retail pharmacy?
So this is Commander Parsons. There should still be individual staff at the pharmacy behind the scenes. That retail pharmacy would need to complete a transfer with that MTF pharmacy. And in the pharmacy world, generally the pharmacy receiving the transfer would initiate the phone call to the transferring pharmacy. So that retail pharmacy needs to call that MTF pharmacy to get the transfer.
And also, just to add, if the prescription didn't have any refills on it, you may also need to contact your provider to obtain a new prescription.
Okay. Natural desiccated thyroid, example, Armour. Can we get this approved if we have tried all other pharmacy meds for thyroid and we are not becoming medically stable? Will TRICARE allow that medication in that situation, assuming our physician filled out the med necessity form? Is that even possible to get it approved?
So with any drug that has a prior authorization, and I have to confirm on this one, there are certain criteria that needs to be met. All of the criteria, authorization criteria forms are listed on the TRICARE Formulary search. That would be something that would have to be reviewed based on information provided by the provider to determine if it meets the coverage criteria.
Next question. I am a spouse of a military retiree. We only have TRICARE Prime. Now we are stranded outside the U.S. My husband needs medications and we are in Chile. What should we do? We have never used Express Scripts. We only get our medications at a military pharmacy.
This is Francine again. As I mentioned before, when you are in an overseas location like that, what you have to do is the provider would write the prescription. You take it to a pharmacy there in the country. I think you said Chile. Fill it, and then you would have to fill out a claim form, a DD form 3642, and submit that to the overseas contractor. And if you go to tricare.mil, search on overseas, and then you can also, or search on claims, and it'll give you a copy of the form, but you will have to pay out of pocket first, and then you will be reimbursed less your copay or cost share.
Great, thank you. Next question. I'm a retiree visiting Florida, not able to return home due to COVID-19. My scripts are usually at an MTF in Virginia. Can I pick them up at an MTF in Florida?
So the answer to that would be it depends. MTFs sometimes have different medications on formulary than other MTFs. But if the MTF that you're near in Florida carries them, that MTF would have to call that other MTF to transfer that prescription.
Next question. I don't see my new prescriptions reflected in MHS Genesis. Will this be available in the near future?
That is a good question. And as MHS Genesis is more evolving, I think that's something we would like to take back just to get additional guidance, make sure we address the question appropriately.
Very good, thank you. In home delivery, is the copay per each drug filled?
This is Katrina with Express Scripts. Yes, when filling the medications through home delivery, the copays will be determined per medication filled.
Okay, thank you. Next question. Are the MTF pharmacies currently limiting Advair to one inhaler or discus at a time?
This is Lieutenant Colonel Pammer from the Pharmacy Operations Division. I'm not aware of any restrictions on Advair since that is a maintenance medication. You may want to check with that particular MTF if they have any supply chain issues.
Next question. Am I to understand that Express Scripts will waive prescription costs shared during the COVID-19 time?
This is Commander Parsons. That is incorrect at this time.
Thank you. You mentioned that there are measures taken to help beneficiaries during natural disasters. Why don't these same measures apply during a national pandemic?
This is Lieutenant Colonel Pammer with the pod. Specifically with those disasters, it's localized to an area, and so information goes out to those specific pharmacies. All retail network, all retail network TRICARE pharmacies do have a code that if you would need your prescription earlier, there is a mechanism for them to go about it. Over.
Great, thank you. Next question. We travel extensively and use a mail forwarded to have our mail sent to various U.S. post office as general delivery. New to TRICARE and wonder, is this a safe way to get our meds? Will the PO even forward meds?
This is Katrina with Express Scripts. So if the post office, it is based on the post office if they do forward the packages that you received. Certain medications may not be eligible to deliver to a PO box. But for the majority, medications can be filled through the PO box. What's important here is with mail order, we would be able to ensure we're able to set up temporary addresses or permanent addresses. So if you know for the next refill you're going to be at a separate address, we can set that up so that that specific order delivers to that address to ensure to get to you accurately. So we definitely will work with you to ensure that we get the medications to you and where you are located, and we can deliver most of our medications to a PO box.
Next question. My military pharmacy has recently given me 2 TRICARE prior authorization request forms for 2 different medications. Each one states you cannot take the other medication. However, I have taken both of these medications in combination for many years. What do I do? Lastly, the forms say they should be faxed to Express Scripts. Does this mean I can no longer receive these 2 medications at the military pharmacy?
Thank you for the question, and that's very specific, beneficiary related. I think we would need to get additional information specific. So if they can send in the information specific to their needs, we can address that to see what next steps are for that specific case.
Great, thank you. Next question. Are there any coordination of benefits with VA and TRICARE and Medicare? I have all 3.
This is Francine from DHA Communications, and regrettably, no, the 3 do not coordinate. Again, by law, Medicare and the VA can't. If you have a exchange funds, if you have a Medicare commercial coverage plan and TRICARE, then there is some coordination. But if you just have the basic Medicare benefit, there isn't. And TRICARE cannot pay second to VA for medical either. They're 3 separate entitlements, is how they're viewed.
Great, thank you. And I think we have time for one more question. I know that my CVS will deliver my prescription for a fee in lieu of going in person to pick it up. Will TRICARE pay for the prescription delivery fee?
TRICARE does not pay for the prescription delivery fee. CVS is currently not one of the network pharmacies and is considered a non-network pharmacy, of which the network pharmacy co-payments will apply at this time.
Great, thank you. All right, I think that just about wraps it up, and that's about all the time that we have for today. I want to thank Lieutenant Commander Robertson and her colleagues for sharing their invaluable experience and expertise. I would also like to thank our attendees for participating in today's webinar. If we didn't answer your question today, please refer to the contact information in your copy of the webinar slide deck. Also, you can find many of the answers to questions about TRICARE on the TRICARE website at tricare.mil. This concludes today's webinar of Making the Most of Your TRICARE Pharmacy Benefits. Thank you.